Temporal bone canals. Carotid canal, Canalus caroticus, through which the internal carotid artery and the internal carotid sympathetic nerve plexus enter the cranial cavity, begins on the inferior surface of the petrous part of the temporal bone at the external opening of the carotid canal, apertura externa canalis carotici. The carotid canal then ascends, bends at a right angle, and runs forward and medially. It opens into the cranial cavity through the internal opening of the carotid canal, apertura interna canalis carotici. Caroticotympanic canaliculi, canaliculi caroticotympanici, originate on the posterior wall of the carotid canal near its external opening and penetrate the tympanic cavity. Through these small canals, the corresponding nerves and arteries pass into the tympanic cavity. Musculotubal canal, Canalus musculotubarius, shares a common wall with the carotid canal. It begins at the anterior margin of the petrous part of the temporal bone, at the border with the squamous part. The canal runs backward and laterally, opening onto the anterior wall of the tympanic cavity. The musculotubal canal is divided by a septum, septum canalus musculotubarii, into two semicanals. The upper semicanal, Canalus musculi tensoris tympani, contains the tensor tympani muscle, which tenses the tympanic membrane. The lower semicanal is the semicanal of the auditory tube, semicanalis tubi auditivi, which forms the bony part of the auditory, eustachian, tube. This structure connects the tympanic cavity with the nasopharynx, ensuring the equalization of air pressure on both sides of the tympanic membrane. Facial nerve canal, Canalus nervi facialis, which houses the facial nerve, cranial nerve 7, along with blood vessels, begins at the fundus of the internal acoustic meatus. Within the petrous part of the temporal bone, the facial canal runs horizontally forward, perpendicular to its longitudinal axis. Upon reaching the hiatus of the greater petrosal nerve canal, it turns laterally at a right angle, forming the geniculate ganglion, geniculum canalis nervi facialis. The canal then continues horizontally along the axis of the petrous part towards its base, where it bends downward, curves around the tympanic cavity, and opens on the inferior surface of the temporal bone through the stylomastoid foramen, foramen stylomastoideum. Chordae tympani canaliculus, canaliculus chordae tympani, begins from the facial nerve canal slightly above the stylomastoid foramen, runs forward, and opens into the tympanic cavity. This canaliculus transmits a branch of the facial nerve, the chorda tympani, which then exits the tympanic cavity via the petrotympanic fissure, fissura petrotympanica. Tympanic canaliculus, Canaliculus tympanicus, starts at its inferior opening in the depth of the petrosal fossula on the inferior surface of the petrous part of the temporal bone. It then ascends into the tympanic cavity through its inferior wall. The canaliculus then follows the promontory groove, sulcus promontorii, on the labyrinthine wall of the tympanic cavity. Eventually, it pierces the superior wall of the tympanic cavity and ends at the hiatus for the lesser petrosal nerve on the anterior surface of the petrous part of the temporal bone. The tympanic canaliculus transmits the tympanic nerve, a branch of the glossopharyngeal nerve, cranial nerve 9, as well as the inferior tympanic artery. Mastoid canaliculus, Canaliculus mastoideus, originates in the jugular fossa, crosses the facial nerve canal at its lower portion, and opens into the tympanomastoid fissure. This canaliculus transmits the auricular branch of the vagus nerve, cranial nerve 10.